I'm Barb Murrah. I am actually from Brookings for the last 40 years. My husband Gene and I and our children have lived here for a long time, and I am a realtor with Best Choice Real Estate here in Brookings. On September 17th of 2014, I had both my knees replaced, and they had been really bad for a long time, and finally got the courage to have it done, and I am so happy I did. The doctor who did the surgery comes here from Sioux Falls a few times a month, and any of the patients he has who would want to have their surgery in Brookings, he will do it here, and he really likes the hospital here in Brookings too, and so it made it handy, if anything else, to be close to family and friends so they could come visit. I was in the hospital for a week because I had both of them done at the same time. Otherwise, I would have probably only been here a couple of days. But it was a really good decision to do them both and to do them here. Oh, I think I was just afraid. I didn't know what was going to happen, how it was going to turn out, and I'd heard such stories from people about how awful it was, that really isn't the case. And maybe I just waited long enough until things got much easier and better, but I never regretted for 1 minute having it done. Not even when I was lying in bed in the hospital. I was just thrilled, and it was a really good experience. No issues at all. It was a lot better than I thought it was going to be. It was really good. When I came in, I thought I would be afraid. I wasn't. Everybody made me comfortable, and just, I think because they all knew what they were doing. They all did their jobs. They asked the questions. When I got to the surgery unit, they welcomed me in. Everybody was nice. I actually knew a number of people in there, so it was almost like a little party. Not really a party, but you know what I mean. They made me comfortable, and just really, they're very caring people, and it was a nice experience knowing that I was going into surgery. Didn't know anything until I heard these voices saying my name, and I woke up and it was done. They just couldn't do enough. Every shift would, they come in and they find out who you are and what your needs are. And even with my family, when they were there, or friends who were there, they would come in and ask if there was anything they could do for them. It was just a good experience. The nurses, the staff, the doctors, everybody. I told somebody that I felt as if we were spending $1 million a day for care, we couldn't have gotten any better care than what we got here. Whether it's minor or major, I would certainly want them to consider coming here, especially if they're from here and their family's going to be here, because having your family and your friends be able to come in and see you and visit with you, I think really helps get you well faster too.